So, good afternoon, all the delegates and the seniors present here. So, at the outset, thanks the organizers of Unicon for inviting me as a speaker here, and thanks Chairperson sir for the kind introduction. So, as I've given the topic, the diabetes in young. So, this year the Unicon theme is to breaking the barriers and bridging the gaps because we are really concerned about the diabetes burden that every day we are dealing with in our practice. The number of patients are actually growing, and definitely the proportion of the young diabetic patients that's also very huge in number. The last week, if I have not seen less than 100 patients with diabetes, then definitely I have seen at least 10 or 15 the young diabetic patients. What is the theoretical definition of the young diabetes? It's in book, the less than 35 years of age has been defined, but still, in the last week, if I'm not wrong, I have at least 3 or 4 patients who are 7 years, 8 years, 12 years, 15 years of age, presenting with the poor glycemic control with a huge diabetes burden. So definitely, when I have requested by Dr. Vishwas to choose a topic on diabetes, definitely I think this is the bridge that we have to at least tackle how to identify the cause of diabetes in the young and how to, in a proper way, to settle the issue with the young diabetes. So I will go a few of the cases at the same time. So as we all know from our student life, that young diabetes are mainly type 1 diabetes because a child is presenting with around 12-15 years of age, maybe with a very poor glycemic control, with the high osmolar symptoms. So these patients have a type 1 diabetes, whereas a 45 year, 50 years of diabetic individual who are presenting there is type 2 diabetes. That was been taught in our student time. So type 1 diabetes definitely, the highest incidence is mostly in 5 years to the adolescence, whereas the antibodies can be present, whether it's a we measure anti-GAD65 antibody, anti-IA, anti-IA2, anti-Z8. But definitely certain population of type 1 diabetes who's a idiopathy have antibody negative, and that is the term we term as antibody positive as type 1A, whereas type 1B who is antibody negative. So there is no familial predisposition of the type 1 diabetes, but there are studies that shows that in families, particularly the twin of type 1 diabetes, have a very high chance of getting type 1 diabetes, and majority of more than 85% and newly detected type 1 patients are actually sporadic. Definitely, it is not in the type 2 diabetes, but in the type 1 diabetes, it's the capital in the world. You can see the number of incidents per thousands. It's almost 24 in India. It's the highest in all the other countries compared to the population same time. Whereas the number of children, at least with type 1 diabetes in thousands, is almost 229.9 in India as well compared to the other countries. So definitely, that is a very tip of the iceberg. We can say the majority of the patients till date they are not getting the proper diagnosis of type 1 diabetes. So coming to the registry that has been found in 2016 data, where type 1 diabetes in 63.9% of the cases, whereas the type 2 diabetes is 25.3 in the young diabetic, the cohort. But what is the situation after a few years? There is a study by Dr. Shaw. There is a heterogeneity in the etiology of diabetes mellitus in young adults. It's a prospective study, and the data published in 3 years after the 2016 study, 2019 data, where we can get almost equal percent of type 1 and type 2 diabetes. So it's definitely type 2 diabetes even in the young individuals are growing, and that is the concern we have because the type 2 diabetes definitely can prevent by lifestyle modification in majority. That is why I actually need all the delegates who present here, all the young individuals who are obese or overweight or the family history of diabetes, definitely the lifestyle modification, whatever be the reason the patient is attending in your clinic, maybe because of fever, maybe because of diarrhea, maybe because of some infection, but still you encourage the patients to at least get the loss of diet, exercise proper, weight loss because of the prevention of type 2 diabetes. Nowadays we actually celebrate the pre-diabetes team. So the identification of the pre-diabetes and diabetes is a very important issue, and that's why at least we can delay the capitalism of India in 2040 has been post for type 2 diabetes that is already reached even nowadays. Out of this 18 to 35 years of the 105 Indian adults, apart from type 1 and type 2 diabetes, we have at least 15% patients who have the HCPD, 2% patients who have MODY, and mitochondrial diabetes is around 1%. So these are typical of a young adult who was recently presented with a 12-year boy. The osmolar symptoms, the father has diabetes. Patients have poor glycemic control, H1 17.1%, fasting 206, postprandial 492. It is a strategy we have to, at least as the patient has osmolar symptoms, we have to start with the multiple subcutaneous dose of insulin. Then we measure, after glycemic control, we measure the stimulated C-peptide level to differentiate, and definitely the patient is having a good the C-peptide level, that means the insulin reserve, that indicates the patient is not typical candidate of type 1 diabetes, rather the patient has type 2 diabetes. You can see the picture, this indicates the black, the pigmentation, this indicates the acanthosis nigricans, which is a sign of insulin resistance, and there's a categorization, like the patient have grade 3 or grade 4 acanthosis nigricans. So we are also getting patients like both the parents have diabetes and the boy or the girl have a very, the age of presentation is around 15 years or less than 15 years. That means the patient who have a very strong family history, even the next generation can